and welcome to Chapter 15, Medication Administration. In this chapter, we will take a look at IVs, how we start IVs, and how we start for injections of contrast media. We will also take a look at some of the signs that you need to look for in case extravasation occurs with your patient. So throughout this chapter, we're going to talk about some key roles of the radiographer. So our job during this is primarily during our IVUs, where we're taking a look at the kidneys. We do start a butterfly needle so that we can inject contrast media into the vein. Medication administration is part of our responsibility for these contrast images. And we typically will set up and start those IVs. There are some facilities that have nurses that will come in and start these. But we also do some drawing of lidocaine for certain procedures, so it's important to know how to do that draw and how is it administer the patients with the radiologist that'll be present in the room. One of the things we have to do is go through a check sheet for allergies, so we look for a history of allergies with the patient. We do have to prepare medication for administration, so we do need to verify our patient's ID. We assist the physician with these administrations, so basically we kind of hold the bottle up so that they can draw the lidocaine out in most situations, and then they will administer this. But we do have to monitor the patient after administration and look for any signs or symptoms that they're having a reaction. So if the state regulations and hospital policies permit, we are allowed to administer, and we chart what medication or contrast medium we did during that procedure. I have a couple videos for you to take a look at with IVs, so make sure that you watch those. It does a nice job of explaining how they're started and what to look for during those IV procedures. Medication orders will be written. They will also be verbal, but most states require some form of a standing order that's in the chart. So this consists of written directions that specify what the physician wants for this particular exam. So there are 6 rights of medication administration. We got to verify that it's the right dose. We want to make sure we have the right medication for that particular patient at the right time with the right route for what has been documented in that paperwork. So no medication can ever be given without physician's order. A normal dosage is provided in a package insert. So most of our procedures come pre-packed. We take the package out and everything we need is in that kit. So that makes it easy because then we know that it's going to have the right amount and the right dosage for our particular patient that we're doing. So typically, we hold the vial up so that the physician can verify what's in the kit before they draw it, and then they administer that to the patient. There are some routes of administration that can be given. Some of these are oral, rectal, through the NG tube. There are some types of medication that can be inhaled, some that are placed on the skin. There's sublingual routes, and there's also perennial injections, which are within our IVs. So if it's an oral, this is pretty common and familiar. We do these at home. We give ourselves, if you're taking aspirin and ibuprofen, the digestive process can reduce therapeutic effects in these situations. Rectal, you may have an infant that required a rectal route before. These are our alternatives if the patient isn't able to swallow. And there are nasogastric tubes, which are also called NG tubes, where we can orally administer the medications through the tube. Anything that's required to be inhaled is usually held up to the nose, and then it's therapy directly into the lungs and respiratory systems. This you're going to see during nuclear medicine for radioactive gases. You're not going to typically see this in the radiology department. Topical route, so these are for creams, for rashes. There may be patches that are applied to the skin. These are more folks that are going to come in with these already on their skin, and then you're just looking to see if they're having a reaction of any kind. Sublingual is under the tongue or inside the cheek. Again, these are more things that will be taking place in a doctor's office, not something that you'll be doing within the radiology department. But we do drugs through perianthal injections, and these are the types of injection routes that can occur. So when we're going intramuscular, it has a 90-degree angle, subcutaneous, 45-degree angle. You could also do a subcutaneous at the 90-degree and intradermal, which is a 15-degree angle. So it's important to know what type of medication you're giving and what type of injection needs to take place. So typically the hospital is going to train you on what types of injections that they're going to do. So when you get there, they're not going to say, go start this butterfly needle. They're going to say, okay, let's have you work with this particular person so that they can sign off and verify that you've had the training. With the perianthal injection procedure, I did give you a couple videos to watch. Those videos do a nice job of explaining exactly what you need to do and how you read the label and select the container to prepare for the dose before injection. So make sure that you're paying close attention to these IV routes. They do a nice job of explaining what needs to be done. So this is a needleless system. So in here you can see that they're injecting into the vial, taking that material out, so if that was lidocaine, and then how they would start into the IV. So there's some dry medication videos that I want you to watch and some extravasation videos that I want you to watch so that you can see what type of reactions to watch for on the skin with individuals after they've had that butterfly needle injected into their skin. So if they're starting an IV or a butterfly needle, this is things that you have to look for and how do you fix when something like that occurs. So basically those are any leakage of fluids outside of the vessel, so it's called infiltration, and it goes into the surrounding tissues, and you're going to see that it's very painful. You'll want to apply a cold pack to the site. If this does happen after you've injected, then you do need to fill out an incident report on your patient. So when you're taking a look at this video, it also shows you how to put on your gloves, do the injections, and then you're going to end with the Band-Aid on your patient because of the blood. To avoid any problems, again, if you are having a really difficult time starting your butterfly needle, CT and Nuke Med Techs are great because they do these all day long. And so one of the things that I'll encourage you on is if it's by the third poke and you can't get it, you need to find someone else to come in and start that for you. So you may need to go across the hall and grab the Nuke Med Tech and have them come start it. Again, if you're at a hospital where you have a nurse that does these, then it's great. But if it's up to you to do it, then you do want to get to know some of the other people in the departments that are pretty good at starting these IVs. So for the most part, we don't monitor many of the IV fluids, but I do want you to be aware of the height of the bottle or bag. So they should be 18 to 20 inches above the level of the vein so that they are raised above the patient so that it flows nicely into the vein and doesn't back up. So if it's placed too low, blood will flow back up into the catheter and tubing, and this can clot and cause that fluid to stop flowing. So even when you're transferring your patient onto the x-ray table or back to the stretcher, make sure you keep that bottle up high so that you avoid any of that occurring. Make sure that you always have gloves and that you're disposing of those syringes directly into that puncture-proof container without recapping so that you avoid any needle stick injuries. If you do have a needle stick injury, you do need to report that right away and fill out an incident report. And then you'll follow hospital procedures at that point for what to do for a follow-up. All right, so in regards to the patient, again, you got to check their ID, check for allergies, monitor your patient for any side effects. And I do have some really nice videos for you to take a look at that really show how these are done and what to look for. You do need to chart your medication, so make sure that you're charting what was given, when it was given, by who it was given. And that's all that you pretty much need to know in regards to this. So this is going to be very hands-on when you get out to clinical. And then at that point, like I said, you'll get additional training. We will try to get you some IV training and some, so you'll get a phantom arm, and you will do some pokes on each other to get you used to this next semester, if it is allowed. So it's because it's with COVID and everything, we have to follow whatever the college's procedure is in regards to this. So hopefully we'll get you working on each other. If not, it's no problem, because you'll get the training when you get out to the hospital. Okay, thank you so much, and have a great rest of your